Is there actually a way for people to increase their penis size, or is that pretty much a misnomer?
I struggle with anxiety and I have sleep deprivation. Are you saying that that does affect testosterone?
Dr. Andrew Hamilton, medical director at Invigor Medical, is a pioneer in peptide therapy, helping patients optimize physical performance and overall well-being.
Today, we are going to answer the internet's most searched questions about sexual health.
There's a lot of different theories as to why there are morning erections, and that's one of them. I think every individual is unique and has their own answer, but in terms of, why it can just go away or why it can just start or why it can, fluctuate in its firmness can all be related to whatever specific issue is happening. So you've got two major blood vessels that run down the length of your penis, and you're getting in one of them and you're injecting.
When I think of a needle in the penis, that unlocks my greatest fear.
Hey everybody, welcome to the Invigor Medical Podcast. We're super excited for today's episode. We've got two awesome guys here. We've got James Timmons joining us as a co-host, and we've got Dr. Andrew Hamilton joining us as our medical director for Invigor Medical. And today we are going to answer the internet's most searched questions about sexual health. So, all the big ones.
Yeah, I'm an unofficial non-expert in that realm. So,
and Dr. Hamilton, he is our expert.
Yeah.
Maybe you can tell us a little bit about what qualifies you to answer these questions.
Yeah, so I'm a family medicine physician, a community doc. I primarily base my practice in educational medicine. Okay. So always reading, always trying to find the newest thing, trying to make sure the residents are up to date with all the information and that they're not wrong with it. Mm-hmm. And I've kind of carved a path into men's health, and I've found while doing that there is a lot of information out there that doctors mismanage, or they don't know yet, or they feel are sensitive subjects, or from just developing a male patient base for myself, men are curious about, but maybe too shy or too embarrassed to ask about.
Yeah.
And so that's really created me to come up with my own education related, directed towards my patients and directed towards medical education for addressing some of these high yield topics.
Awesome. Yeah. And, the thing that comes into my mind is that you got people that aren't necessarily qualified to talk about certain things, with their volume turned to 11, blasting out who knows what, whether it's true or not. So I think today's conversation is going to be super interesting and really informative. So with that being said, let's just dive into it. I mean, there's a lot of big ones here, but I think that on that note, maybe we can start right away. Because I searched everywhere. I searched Reddit, I searched Facebook forums, I searched as many places I could see to see what kind of questions are people interested in when it comes to male sexual health. And honestly, the one that kept on popping up over and over and over again is, does size matter? So maybe we can start with the big one.
Yeah, the big question, does size matter?
I feel like we're unqualified to answer that, but go ahead.
I mean, it's I don't want to say it's hard to say. There is a relatively simple solution, and it's, if you and your partner are happy, then whatever that size is fine.
Yeah.
Now, I think there's a lot of questions that go into that, so it might not be as superficially as easy of a question as it initially appears to be. If as a male you are concerned about pleasuring your partner, making sure that she has a good orgasm and having a good sexual experience, what do we know from the penetration standpoint?
Yeah.
Is that the G spot, or that spot that's a little bit of rougher, softer tissue, maybe equated to the pelvic bone in a vagina, only being approximately 2 inches up the vaginal canal. The simple answer to that is no, it doesn't matter, because, for the most part, men are going to extend the length of 2 inches when they're erect and having, a sexual interaction. In terms of, body habitus and making sure that you can get to that point, that's, another discussion to review, and just making sure that, you have not an overly abundance of central adipose or belly fat, but you can actually partake in the sexual experience. And again, when it comes to relationship building and having a good relationship with your spouse or your partner, there's a lot of different things that go into that other than the length of your penis. And so the answer to that is, again, does it matter? Probably not. Now, the one time that I would probably answer yes, it does matter is when we're addressing like anxiety or worries about it, and we're trying to address those more psychogenic components related to your sexual experiences.
Gotcha.
Well, that's great news for the short kings.
That's right. That's right. So, like, I know that there's a lot of guys that are out there that are trying to increase the size of their penis, and like, man, I've seen some crazy stuff out there. Like,
Sure.
It's interesting here at Invigor Medical, we get a lot of people asking us those questions. And so one time, one of our treatment specialists actually got a phone call, and they're like, "Yeah, I'm taking there's like this medical device that I'm using to try and increase the size of my penis." And like they sent us a link, and they started watching it. I'm like, "We need to turn that off, guys. Like, take it down." But like, is there actually a way for people to increase their penis size, or is that pretty much a misnomer?
I think if there was an easy medication or a simple solution to that, everyone would already know it.
Yeah.
And so I think that's an easy no. There's not a good way to increase your penile size. I mean, it's soft tissue. It's based on blood flow. It's based on arteries. It's based on blood vessels.
Yeah.
And so there are physical and medicinal mechanisms that suggest like, hey, we can make that soft tissue grow a little bit larger, but there's no statistics, there's no good studies that say this is a good solution. And even any sort of length discrepancies or length increase that you might get from some of these mechanisms are very likely to go back to what it initially was, because it's just soft tissue. Once the inflammation decreases or once the blood flow decreases, you're going to go back to what your natural anatomy is.
And they could even be dangerous, right? Because they I'm imagining certain things could cause scarring, could cause things like Peyronie's disease, and
yeah, you could be causing worse problems for yourself just in the process.
Yeah. So bad news. Don't try it, guys.
No.
Just be proud of what you got.
Yeah, if you want to increase your penis size, just watch 90s Baywatch. Sorry.
I'll let you. We've got a whole list. We've got a whole list of questions. I'll let James take the next one.
I had a question off the top of my head. I know that I guess it'll segue right into this. It says, can stress or anxiety cause ED? But then I was also, does stress and anxiety maybe diminish testosterone, to your knowledge?
So I think there is certain fluctuations that, it plays a component to it. Okay. Anxiety plays into insomnia and poor sleep. It plays into poor exercise habits, poor dietary habits, all of which change your body habitus, increase your obesity.
Yeah.
As we know, fat produces estrogen, and it converts that testosterone to estrogen. So that's going to deplete your testosterone. Wow. And it's if you have like sleep deprivation or sleep issues, that's going to get your circadian rhythm off for your fluctuating hormones, which typically spike in the morning.
Okay.
And so I think there is maybe a little bit of a less direct component on how that's playing a role.
Okay, that's interesting. So then you would say, because I struggle with anxiety and I have sleep deprivation. So are you saying that does affect testosterone?
Certainly. So testosterone follows what we call a circadian variation, meaning your levels, like a lot of your hormones, not just your testosterone, but they typically spikes early morning. So if you have a normal sleep schedule, it normally spikes around 7, 8 a.m. And so when you get like your hormone levels drawn, you always want them, within that first 2 hours after waking. And then you also have your lowest point later in the day, about 12 hours difference, when you should be kind of wrapping up the day and possibly going to sleep. If your sleep cycle gets off for whatever reason, sleep apnea, anxiety, other insomnia related reasons, your body's going to start reacting to that. Your cortisol levels are going to change. And as a result, your hormones are going to change as well.
Oh, gosh. Yeah. Okay, so then that segues right into the next question there, because you said that the morning is when you have your highest flux of hormones. So then would that kind of explain morning wood?
It certainly could.
Okay.
So there's a lot of different theories as to why there are morning erections, and that's one of them.
Okay.
Right? Your body is triggering all these hormones, and so, hey, your testosterone spikes, and you are getting erections upon waking.
Right.
You could have a full bladder at night.
Yeah.
And as you are stimulating that kind of rest and digest tract of your nervous system, the parasympathetic nervous system, which is also responsible for erections, it could be stimulating the erection. Or because you have the full bladder, it could be pressing on your prostate gland, which could be in turn causing you to have erections as well.
So you talk about the parasympathetic nervous system and activating that, right? So that's kind of like you said, the rest and digest. I've seen very recently like a huge interest in things like ashwagandha and things that kind of I believe it's like an adaptogens that really promote parasympathetic activation. Would you say that those are good supplements for people that are wanting to have better sex?
I think that should all be on a very much of a case-by-case basis.
Yeah.
If what you're concerned about is like having better, longer, stronger erections or just like a better sexual experience overall, it's important to maximize your lifestyle first. Eating a good diet, getting regular exercise, getting good sleep, making sure that you have a good relationship with your partner so that there's no like psychogenic type causes. If at that point you feel like you have maximized everything and you want to consider supplements, you just have to weigh the risk versus benefits. There are kind of like homeopathic remedies for like erectile dysfunction, yohimbine being one of them, and red ginseng being another. But these are non-FDA approved supplements. So it's all, kind of patient-based and how the patient thinks they respond to it.
Well, and like non-FDA approved supplements, the supplement industry as a whole is so like, it's because it's so unregulated.
Yeah.
It's like you have no idea what is actually in that pill. And like, some people, if you're getting really good stuff and you're doing your homework, you're getting stuff that's third party tested and is making sure. But like, I remember something like there was some creatines from like a not very well established brand that like somehow like steroids or something actually got mixed into this creatine. So something that's actually really good for you now all of a sudden has like some major dose of like some crazy supplement in it. And it's just like, man, that is absolutely insane. So yeah, it's very, I totally agree. It's super important to make sure you get your supplements from a very good source.
Yeah. And like the brief anecdote that I have from it is, a patient coming in saying, hey, I'm taking this over the counter supplement. And I go, okay, we'll bring it in next time. Let me actually look at the label because, the patient wants sildenafil. They want Viagra for erectile dysfunction. And I look at the medication, and the medication, or the supplement, I guess I should say, had trace amounts of sildenafil in it. So now I'm like, okay, if you don't know what you're taking, then you're going to overdose on this medication. I'm going to be prescribing you doses higher than what you actually think you're taking, and no one's going to know about it. So you do have to be very careful with selecting supplements.
What's sildenafil?
So sildenafil is a medication, a class of medications for the phosphodiesterase inhibitors. Long fancy term, it's a class of medications that treat erectile dysfunction.
Okay.
Increases smooth muscle relaxation. It allows the penis to become engorged and allows erection to happen.
Yeah.
Okay.
The name brand of them, so sildenafil and tadalafil are of a similar drug class. The name brand versions of them are Viagra and Cialis.
Okay.
Yeah. So basically, these guys were essentially sneaking in like little bits of Viagra or Cialis into this supplement, which is absolutely crazy.
And again, if the medication is in a low enough dose, it doesn't have to be reported, to the FDA.
Yeah.
It doesn't have to be monitored.
Okay.
Right. Only particular concentrations of medications need to be reported.
That's kind of brilliant, though, if you think about it. If you want to sell a supplement,
Yeah.
crush up a little bit. You could that would work for a lot of products.
And probably does. It probably would surprise you, to be completely honest.
Yeah.
But just things you got to watch out for.
You got to be careful for.
Yeah.
it. So
It's like, man, these Flintstones vitamins are making me feel good.
Trace cocaine in there.
Yeah, that's you got to be super careful with that. I was gonna ask, you talked about tadalafil and sildenafil overdose. Like, what does that look like? Like, what does somebody have to be careful of if that?
I can probably guess what that looks like.
Yeah. I mean, you take too much of it, or it doesn't work working your body the way that you expect it to, you could have an erection that lasts longer than 4 hours, which is that trademark statement that everybody knows from the Viagra commercial.
Yeah.
You know,
Right.
if you have an erection lasting longer than 20,
What a nightmare.
yeah, lasting longer than 4 hours, go to the emergency room. And everyone's like, I'm not going to the emergency room if my erection lasts longer than 4 hours. I'm hanging a flag and showing the neighborhood, and so the reason why that statement's there and the reason why you need to get to see emergent care is because having an engorged penis for that long can start to actually cause lack of blood flow to the tissue in the penis that needs it, causing tissue necrosis and permanent nerve damage, permanent tissue damage. So it's really a non-joke, right?
Yeah.
You need to get treatment
Yeah.
if it's not going down.
Yeah, and erection that lasts longer than 4 hours is called priapism. Is that right?
That's correct.
Yeah, and then having that long-term damage, if it lasts longer than 4 hours, you can chronically, you get something called Peyronie's disease. Is that right?
Yeah, so Peyronie's disease is, again, it's a separate diagnosis. There's a lot of different things that can cause it. But essentially, chronic inflammation, chronic scarring can cause that disease, and that certainly can be a contributing factor.
Yeah. What would you say are the most common causes of penis scarring? That sounds terrible.
Yeah,
I mean, saying that.
I don't know the number one off the top of my head, but if I were to conjecture, I think recurrent trauma. So, injections into the same spot. Some of it is genetic related some people are more prone to scarring than other people. Some of it can be genetic related. And chronic inflammation, things like that.
Yeah, I know that I saw something recently where, like, in a totally different culture, the way that they basically, when they are done with having their erection, the way that they get rid of it is they like bend it, and they essentially break their erection. And I'm like, oh, that sounds terrible. But I would imagine that type of thing repeated over and over and over again would cause major issues in the long term.
Yeah, I would think with that you would have a lot more other issues before the scarring happens. I think you would have vascular and nerve-related issues, but if you get to that point, certainly.
Man.
Break your erection.
Yeah.
Jeez.
People are crazy, man.
Usually just wait.
Yeah.
Just wait, it goes away.
Well, actually,
They must be really impatient.
Yeah.
Yeah. That's terrible.
No, the advice we have, so because we offer Trimix here at Invigor Medical, and that's a very potent, very powerful medication for people where like ED medications don't work for them, and it's very common for our men to have an erection that lasts an hour, 2 hours, 3 hours, and so with that we always make sure that they have phenylephrine on hand, which is like a reversal agent. But before they inject with the reversal, we tell them there's kind of steps of like ejaculation helps with the process, but if it still doesn't help, then running laps up and down your stairs, or like taking a cold shower or things like that. Are there other methods of, like, so you're on your way to a priapism? Are there other things that are good for getting that flagpole back down?
Yeah, theoretically, anything that would activate your sympathetic nervous system. You think of the point and shoot model. So point being the parasympathetic, which causes the erection, the sympathetic, the shoot, which causes the ejaculation. Anything that will inhibit the parasympathetics from continuing or from kicking on is going to hopefully solve your problem.
Yeah. Cool.
I just have so many visuals. You mentioned running, and so I'm imagining somebody running with an erection.
Well, what's crazy is like there's some other clinics that because we sell Trimix online, and we have phenomenal practitioners who really walk people through it, and we have a lot of resources that we provide to our patients. But there's some clinics, and I think typically it's done where if you want to have sex, you have to book an appointment and go in to see a practitioner, and they have to inject it for you, and then you have to have a really quick drive home. Because so like I'm just imagining the men out there that are trying to drive back home, and I don't know how they do it, like to just wear really baggy pants, like who knows?
I guess, I don't know, tuck it up and get in the car.
Something. So yeah, it's pretty interesting. Well, I guess maybe while we're on this topic, Trimix injections, penile injections, people hear that and they just get really wigged out. Are they as scary as they seem?
So, I mean, I think the short answer to that is probably not. So, one of the ingredients in the Trimix, the alprostadil, is actually the second line medication for erectile dysfunction after the PDE5 inhibitors. So, it's a second line recommendation right after, hey, if Viagra or Cialis doesn't work for you, you might want to start thinking about injectables. And quite honest, you and me driving down the road, if we're not having any problems with our erection, no, thank you. I would not like an injection into my penis. But someone that's having quality of life issues, problems with their partner,
It's a
they
game
might have
changer.
yes, anxiety that keeps revolving. All of a sudden, you're like, I will try it, and most patients have very positive outcomes with it.
Yeah. And I guess the biggest one that I always hear is like, does it hurt? Because you think about that in such a sensitive area. And it's just like, but what's your experience, or what are patients' experiences generally with Trimix?
I think what I hear a lot of patients say is, yes, they do feel the prick, but it's very manageable, and it's not like overly painful.
It's like a pinch.
Yes. Yeah. And again, once you're at this point where you're on like a second line medication, trying to treat this disease, you're willing to deal with that pinch, just so that you can actually have a better quality life in other aspects of your life, which, you're trying to balance everything in your life. And all of a sudden your quality goes up, your partner's happy, you're happy, and it's all of a sudden not a big deal.
Yeah.
It's the injection is,
Or is it a big deal?
oh, pun.
It will become one.
Well, depending if you're one of the, okay, so the injection's at like the base of the penis, right? Like you're not going into the,
It's kind of like
into
in the
pee
side,
hole,
right?
Okay.
Yeah, so you've got like two major like blood vessels that run down the length of your penis, and,
Okay.
and you're getting in one of them, and you're injecting it. That's going to cause the
when I think of a needle in the penis, that unlocks my greatest fear.
It's something that we all try to avoid in
Yes,
life.
absolutely. No, we're not telling people to like put a nail through it. It's like an insulin syringe.
Yes.
So
Yeah.
it's teeny tiny.
Okay.
Long enough to inject into the corpus cavernosum.
Yes.
Is that what it's called?
Yep.
So if you look up the anatomy of this, there's some great channels out there. One in particular, the Institute of Human Anatomy. They've done multiple videos of talking about like the anatomy of the penis and how it works to get an erection. So like if you're wanting to find something like that, check them out. They're awesome.
Yeah.
But yeah, I mean it's absolutely it's a complete game changer for a ton of people.
Sure.
So yeah, cool. Well, you said something earlier. The parasympathetic and the sympathetic, you have the point and the shoot. So are these systems like simultaneously running at the same time?
So they balance each other.
Okay.
They are divisions of what is called your autonomic nervous system. And so
Yeah.
this is the part of your nervous system that like you can't necessarily control the same way that like when I want to raise my hand, I can raise my hand. I can't choose necessarily when my body chooses to digest food, but when there's food there, the nervous system kicks on.
Yeah.
And it's a balance. So what happens when you're getting an erection or during a sexual encounter is that the parasympathetic nervous system is working up to get you that erection and to maintain it. And all of a sudden, the floodgates open, they open up the gates, and all of a sudden the sympathetic nervous system slams on, which is what causes the ejaculation, and the parasympathetic turns off. There's a lot of fluctuations going on in a male body when that's happening, which, again, all plays a role in kind of our experience.
100%. So it sounds like a very dynamic experience, which kind of leads me to this next question of like, why is it that sometimes like you can be in the middle of having a sexual intercourse and then erection's just gone, or it's like right before and then it just disappears, like, or let's say that you have the opposite problem where you go too fast, where it's like you're 2 seconds, what is the anyways,
one pump chump.
yeah, that's it. So like what about so we kind of have two different situations, and I guess another one is like, what if you just can't go, and it's like it just keeps going and going and going. They're like, all right, it's been like you took your Trimix an hour ago and we're still going
Usually that's alcohol related, and you've like taken a pretty promiscuous woman home. Sorry, but I digress.
I mean, there's certainly many causes that things that can lead up to that.
Yeah.
And when you try to like bin the reasons of why you might have sexual dysfunction, I mean, it could be vascular, cardiogenic, it could be psychogenic, it could be hormone related, it could be neurogenic. It's really hard to pinpoint. I think every individual is unique and has their own answer. But in terms of, why it can just go away or why it can just start or why it can, fluctuate in its firmness can all be related to whatever specific issue is happening at that time. And it's all very, very independent of the person.
Gotcha. So if you are having issues like that, like talk to your practitioner, talk to your doctor.
Yeah, and I think you need to have, a full conversation about it. I think what a lot of doctors do is, males have problems and they go and they talk to their doctor and, all right, you're having erectile problems, here's Viagra.
Yeah.
And you're not actually talking about like what's going on, and you're not having a full conversation. And sometimes you need to kind of work through that a little bit to realize, hey, this is not physiologic, this is not related to my body, this is more psychogenic.
Yeah.
It's more related to my anxiety or my depression or what have you.
Yeah. Well.
Yeah, I mean, I've experienced, not to overshare, but in my younger days, I've experienced like the whole going flaccid in the middle of the session. And I mean, you feel horrible, like you're gonna hurt the woman's feelings. But yeah, for me, it was always psychological. So I like that you stress, like, make sure you've kind of covered all the bases in life before you just jump into a pill.
Right.
But I mean, it might be fun though, just to jump into a pill when you don't even need it.
Yeah.
Although because I remember talking to you guys about Trimix a long time ago, and like apparently it's a pretty sought after supplement in the porn industry, right? Because guys have to, it's like
they've got to perform.
Workload.
Yeah.
No pun intended.
No, totally pun intended. Own your puns.
Okay.
James.
Well, that was really an unintended pun, but I will run with it.
There you go.
Yeah. So yeah, I mean, do you still get hit up by the porn industry for?
Yeah, I mean, like we our treatment specialists, they run. I mean, every person from every walk of life. But yeah, I know there's definitely people out there that are in that industry that are hitting us up because they've got to. They need to fit a certain a schedule, and that's totally crazy. But
yeah, speaking of porn, there was a question here that was related to it. Let me see. I can't. Where is it? Oh boy.
I think it was something like, can watching too much affect your sex life?
Yeah.
Or maybe
there it is.
Certain types, something like that.
Yeah.
Maybe even like tying that into, because oftentimes porn viewing is also like mixed with masturbation. Like, how can that whole picture like affect the overall sexual health?
I mean,
landscape.
It can significantly affect your picture, and the thing that's like with social media and our culture and our availability towards images, I think it's becoming an increasing problem right now. And I mean, there's a lot of different things at play. I mean, when you can just scroll through videos or scroll through pictures, you get desensitized to all of that. Your brain gets desensitized. You have a dopamine release when you get something that you like in your brain, and all of a sudden you can kind of make it that the dopamine release you might get from your partner isn't enough, or maybe even the dopamine release you get from just looking at a single picture or a video is not enough, and all of a sudden you need to be on there for a half hour, an hour, 2 hours a day just to get a proper release. And so there's definitely that component to it. The other thing with masturbation is over desensitization of your nerve endings in your penis, and then all of a sudden you can't respond the same way during an actual sexual encounter with your partner. So there's a lot of different ways that it contributes, and you do have to be careful.
Yeah, there's a clip from Huberman where he's talking about this issue specifically, and something that he wasn't necessarily making any claims, but kind of like his observational view of it is like, there's a lot of chemicals that get released when you have this type of experience, and it's like oxytocin is a big one. And if like you're watching other people have sex and you're releasing all this dopamine and all this oxytocin, then all of a sudden your brain associates not you having sex with your partner. It's now all of a sudden your brain is associating watching other people do it. And it's just like it can cause issues, and so then all of a sudden, when you do want to connect with your partner, it's like this isn't the stimulus that we're looking for. We're looking for something totally different.
Yeah, you're conditioning your brain to a different stimulus. It's almost like classical conditioning.
Yeah.
With Pavlov's dog, right?
Yeah, crazy. Yeah, and on your point as well, like the amount and like how pervasive it is. It's almost like how pervasive, we on one of our previous episodes we talked about how pervasive really hyperpalatable food is, and how that affects us and obesity and all that. Like, I would imagine that essentially porn's kind of like sexual junk food for our brains, and that it like in the long term it's not going to be healthy for us, and it couldn't be something that is really going to be beneficial for relationships in the long run.
Right. And I think one of the big takeaways, just from the overview of this entire podcast, is that it's not that porn necessarily is bad. People share it with their partners. They make that part of their sexual experience, and that can be okay if it works out well for them, and that's the relationship that they're having, and that's something that they only introduce when they have sexual encounters or sexual episodes. So it's not that we're dissing the porn industry, but it is that it needs to be used appropriately, or you could have other physiologic issues that arise from it.
Yeah. Crazy. Looking through these questions, actually, there's something that you said earlier, that as you lose weight, you can gain size on your penis. So, like, when you say that, is it just that it's more access to it, or is it that literally you like it comes out of its shell, or like how exactly does that work, or is it just that it's covered and
Yes. So I think it's primarily just like a physiologic response to you being able to visualize it. It's not that anything is necessarily changing with your penis, but like you can just see more of it. It's not being covered up by fat. You yourself can look down and visualize more of it. And the other thing I was getting at is that, if you have a body habitus that lends itself to having, being able to be inserted, but also be closer with the rest of your parts of your body, that's going to have a better effect as well. If you're struggling with like your belly or with like your pelvic fat, and you're struggling to just get it in, that's going to put stress on your relationship as well.
Yeah. I think another big question that I saw, and something that I saw as a recurring theme, is like natural remedies. And we talked about that a little bit with like ashwagandha. But some people are like, oh yeah, just eat a lot of watermelon because of the citrulline, or eat a lot of beets because of whatever else is in beets that makes them. Is it arginine that's in beets? Anyways,
I'm not
like
sure.
Natural remedies, eating lots of food that's going to increase all these things. Like, is that actually going to work, or is that just kind of like,
I mean, I think it's pretty case specific. Again, it's not an FDA recommendation. So when it comes to that, if I have a patient that swears by it and is like, it works for me, then I'm gonna put 2 thumbs up. I'm like, great. It's a pretty healthy food.
Yeah.
It gives you an erection. It's doing what it wants to do. I think that's great. But on the whole, if I were to tell all my patients, hey, just eat more beets or have more watermelon, I would assume that from a scientific standpoint, I wouldn't expect to see like a significant spike in erectile dysfunction resolution as a result of that.
Unless you sprinkled some Viagra on the watermelon.
Yeah, it's under the components of reporting it. So
yeah. That's right. Oh my gosh. Yeah. If you see a watermelon that says this is good for giving you erections, just be careful of what's could potentially be in it. Yeah.
Yeah.
Let me see here. I'm just looking at a couple of things. A big thing that was interesting to a lot of people is the issue of like fertility, vasectomies. Like some people were curious about like how can you maintain your fertility and make sure that that's where it's at. But then if you want to get a vasectomy, like can the vasectomies actually like cause ED, or is that a misnomer?
Yeah. So I mean, I think there's a couple of different questions in there. So
you can break them down.
Yeah. So if you're trying to be infertile, right, and you want to get a vasectomy, so you're having a urologist or you're having a physician cut the vas deferens in your scrotum, which stops the semen from getting out your penis. So that is a way of stopping conception. Is that permanent? It needs to be considered permanent at that point. There's always like a risk that it doesn't take, right? You always hear that expression, it doesn't take. And that's because somehow through some odds, the sperm still found their way back into the other end of the tube and they made it out. Or, there are, microsurgeries that might be able to reverse it. But because of all the scarring that happens because of the way that you do the procedure, a lot of the docs burn both ends. You need to consider it to be a permanent solution to fertility, that once you get once you get your vas efferents cut, that's a permanent
It's pretty
thing.
much that's it. Yeah.
Yeah. In terms of it causing impotence so that you are unable to get an erection, I think that's more related to kind of like the psychogenic component to it. Like in your head, like you had something done down there, something's different, and now something's not working. There's really no direct correlation between, okay, we cut your vas deferens and now you've got like a nerve problem to your penis. Now you've got a vascular problem to your penis. I think that's less likely.
Gotcha.
And I think if you look into some of the literature, that's what they say as well. It's more mental than anything.
I can't even imagine. Have you guys ever considered vasectomies?
Well, I've considered it. I'm unsnipped currently, but
Oh, are you?
Yeah, I mean, it's always an option. Honestly, the patients that I've seen have gotten them handle it very well. It's a very simple procedure.
Yeah.
It's an outpatient procedure, so you're lying on the table in an outpatient setting, and the urologist or primary care doctor, if they do the procedure, takes care of it in 10, 20 minutes.
Yeah, I've actually heard some instances of the wife coming in and watching the operation get done. I'd be like, I want proof.
Yeah.
I'm not getting pregnant again. And,
Yeah.
just like, oh my gosh, that's crazy.
That's pretty morbid. Yeah.
Yeah. Cool. Well, I think, there's a lot of questions here. I guess my question for you is, what are the most common questions that you get asked, and how do you go about answering them?
I think it's not as much about what are the questions that I get, but what are the conversations that I have with patients. And I think what I see a lot of is I see males come into my office and they say, I'm having erectile dysfunction. Can I get Viagra? And they want the conversation to stop there, or that's like that.
Well, because it's embarrassing, right?
Right, and there's their solution. And I think that there are a lot of doctors that don't dive into the conversation or don't know enough about the medications to make actually good recommendations or to have a full discussion. And so I think really the interaction that I have with patients the most is spending a lot of time. A full patient encounter on that day. Talking through the different options, talking about the reasons why it could happen, and what they can do about it and what their concerns are about it. Because the one thing that I always remind everybody is that erectile dysfunction only becomes a dysfunction once somebody's unhappy. Right? So if you're not trying to be sexually active, or your spouse is not unhappy because they don't want to be sexually active, or you're having premature ejaculation, but neither party cares because they're just happy if it's a little bit shorter, then it's not a problem. And sometimes people need to be reminded of that, and so that's just something to also address.
I've heard that sexual health is basically really just connected to overall health, right? Kind of, we talked about the obesity connection. I've heard that basically maintaining your fertility and all that kind of things, oftentimes kind of like what you're talking about ties back to our cardiovascular aspects and nervous aspects and mental aspects. And so as long as those things are tuned up, the rest is kind of left up to preference, more or less.
Yeah. And so once we walk through those steps with the patients, hey, do you have any cardiovascular risk? Do you have a nerve problem, a neurogenic risk? Do you have any anxiety or depression related to that? As soon as we check all those boxes and say, hey, you are medically managed, optimized right now, then that's where it's okay, now what do we want to do? Do we want to do a pill? Do we want to do Viagra? Do we want to do tadalafil? Do we want to do the injections? Which I'm just going to throw this out there. One of the things about the alprostadil injections is that a lot of doctors don't do them because they either don't know about it
or they're scared of it.
Or they don't feel comfortable doing it. And so it's not ever a recommendation. It's not ever a discussion. And it's a second line medication, a very, well established medication is just kind of put off to the side because, they don't do it.
Right.
And so that's, another thing that you need to consider.
And in that case, you might want to seek out a urologist who specializes in that type of thing, right?
Yeah. I would imagine that a lot of primary care docs don't do it. It's not hard.
I mean,
They just don't know about it.
It'll make them hard.
I was gonna say.
Well, hopefully not the doc.
Yeah, let's hope
Unless
not.
they're the patient at the time.
Yeah.
Oh, there's a whole documentary on that. Go ahead.
But the point is that, you know, if it's something that you're interested in, seek it out. So if you're not getting the answers from your doc, go see another doc or go see a specialist. And if you are a physician listening to this, I would say if you don't know about it, read up on it.
Yeah.
There's not a ton of literature that's going to take up your time to the point where you're like, oh, this is probably a pretty good recommendation for some patients.
Yeah.
So learn the procedure or learn where to refer when you need to.
Absolutely. Well, very cool. Well, I think that we covered a lot of awesome questions. Is there anything else that's like burning in your heart, James?
No, I mean, I'm like so like sexually triggered. I'm just all this talk. No, I'm kidding. No, I mean, that's a lot more information than I was anticipating. So
Yeah.
I feel educated.
Yeah, I think this was great. If you have any questions that we didn't answer, feel free to leave them in the comments, and we're going to be happy to, because Dr. Hamilton's going to be around for a while. So if you have questions, we'll shoot them his way, and we'll definitely get those answered. So